Numbers from Public Health Ontario show the 7-day average for new COVID cases has risen by nearly 500 in just 1 week. It now sits at just over 2,600. In terms of today's numbers, 3,270 new infections are logged. Over the course of the pandemic, more than 194,000 cases have been diagnosed. 29 more deaths are linked to the virus, bringing that figure to 4,679. And more than 2,000 additional cases are considered resolved, raising that number to nearly 165,000.
In terms of the regional breakdown, 917 new cases are reported in the city of Toronto, with 581 in Peel region. York region has 389 more cases, with 122 in Durham region. There are 94 additional cases in Hamilton and 70 in Halton region.
New restrictions for workplaces in Toronto are expected to be announced today. CTV's Mike Walker joins us live from City Hall with those details. Mike.
Well, Michelle, the measures will include additional safety and reporting requirements that the city hopes will help curb the spread of COVID-19 in workplaces. As Toronto records 917 new COVID-19 cases today and public health officials bracing for another surge in the days and weeks ahead, the city is set to impose more restrictions at workplaces.
There still have been a significant number of workplace outbreaks in places where people are still working.
Brace for an extended period of potentially unsettling and discouraging numbers.
Toronto's medical officer of health hinted last week that further restrictions would be rolled out to help slow the spread of the virus.
These steps by Toronto Public Health are meant to create as much distance and safety as possible.
Toronto Public Health is reporting 28 active community and workplace outbreaks. The mayor says the new requirements will include added safety measures and enhanced reporting requirements.
When there is an outbreak, there's a greater requirement to report it. There will be more public reporting and transparency. This is on the theory that information is power.
Toronto has been under provincial lockdown restrictions since mid-November. This bioethicist says it's unclear if it will make a significant difference, but
what else can we do? The numbers are terrible. We can't leave any stone unturned, and hopefully these restrictions will at least partly help. It's hard to imagine they'll help in a massive way, but look, we have to do everything we possibly can.
Now, workplaces account for the second highest number of known outbreaks next to healthcare institutions. City officials will be announcing more details about these measures later this afternoon, and we'll have all those details tonight on CTV News at 6. Reporting live, I'm Mike Walker. Nathan, back to you.
All right, thank you.